Advances in technology are allowing doctors to help determine who may be at risk of certain types of cancer. Identifying specific genes can give people the tools they need to help them figure out what their options are before cancer occurs. Here's more on how people can make plans to stay well beyond a diagnosis.
Most diagnoses come after a person has contracted an illness or disease, but some illnesses have a family connection. In the case of certain types of cancer, it is possible to look at what has come before to get an idea of what's ahead. Genetic counselors can review family histories to help determine the cancer risk to an individual or members of their families.
I meet with patients and their families who have a personal or a family history of cancer. And we discuss general things about cancer, but also specifically for most people, whether or not their family or their personal history is suggestive of a hereditary syndrome that predisposes to cancer.
Gina Nuccio of the Baptist Cancer Center works with people referred by doctors or who come in on their own to help them determine their hereditary risk. That means carefully reviewing the occurrence of any type of cancer in the family.
There are several red flags that we look for in someone's history that may indicate that there is something hereditary going on. We can see multiple people in the same family with similar types of cancer.
Technology also plays a role in the counseling process. Testing can spot when people have mutations in genes. Having the mutations called BRCA1 and BRCA2 can greatly increase the chance a woman will develop breast cancer. Finding those or other mutations can give women the opportunity to act.
And the truth is that there is a lot you can do with the information. So for example, if a woman discovers that she has a genetic mutation that predisposes her to breast cancer, instead of getting the yearly mammogram that the woman in the general population would get, that woman might decide that she wants to do increased screening. So usually that involves a mammogram and a breast MRI that she does every 6 months, so it's pretty frequent. And people can also start doing those screenings at earlier ages.
In some cases, women may elect to take what may seem like drastic preemptive action, opting for a double mastectomy to remove breast tissue before any diagnosis. That was the choice of 24-year-old Alan Rose, who represented the District of Columbia in the 2013 Miss America pageant. Her mother, grandmother, and great-aunt all died from breast cancer, and she carries a rare genetic mutation. Rose made the announcement that she would undergo surgery to remove both breasts when her time as Miss DC ends. Genetic counselors work to help people like her deal with the emotional impact of that decision-making.
We have graduate level training in not only medical genetics, but also in counseling. And as you can imagine, as you're discussing these really sensitive topics of cancer and family dynamics, a lot of things can come up, and the counselors are trained to be sensitive to those issues because this information not only affects the patient but also their families.
For more information, you can contact the counselors at the Baptist Cancer Center at 226-4064 or the counselors at the Baptist Breast Risk Management Center at 226-0810. For Smart Medicine, I'm Doug Johnson.